welcome to the Voice of the Coast. I am your host, Danica. Along with me, we have Stephanie Guidry, who is the CEO of Franklin Foundation Hospital. Now, pause for a moment, because that may be the last time you ever hear me say Franklin Foundation Hospital, because we're here to talk about the name change, pretty much the whole branding change of Franklin Foundation. And let's talk now. What is going to be the name change?
The new name is going to be Bayou Bend Health System.
Awesome. There you heard it right here on the Voice of the Coast. So why Bayou Bend and why the name change?
Because, as you all know or should know, Franklin Foundation has expanded tremendously. It's not only a hospital, now we have medical office building, we're building a wellness center, we have a lot of off-site physician practices. So we're really not just Franklin Foundation Hospital anymore. We are a system, and we wanted to go with a name that would allow us additional growth and still be under one umbrella. And we also felt that Franklin Foundation was felt too exclusive, and that we provide care to a service district that was not just Franklin Foundation or Franklin itself.
Right, exactly. And then, of course, the name itself is pretty indicative of what Franklin is. So tell me why Bayou Bend, if you could explain that.
Sure. So, you know, the Bayou has, in St. Mary Parish, has 3 bends or 3 curves, or however you want to describe it. One is in Sheraton, one is Irish Bend, and one is in Franklin. So when we looked at the geographical layout of the parish and the west side of the parish, and the industry that relies on the bayou, it only made sense.
Yes. So, of course, that's a little history knowledge for folks who are like, I never knew that. I guarantee there's some folks who are saying,
I've heard that.
I never knew that.
They never knew that, yeah.
And speaking of, you've heard that from individuals, what has been the response, or what's the feedback from the community?
Well, it's so new that I really hadn't gotten a whole lot, but we did present it to the St. Mary Parish Council, and they did a resolution in support, so that was very exciting.
Awesome. So, of course, we will probably hear from the community. Someone's going to, it's going to trickle. That's how it usually happens.
Yes.
And, of course, hopefully from the Voice of the Coast, we'll get folks talking about it.
Yes, I hope so.
And with the name change, I mean, there's going to be a lot of changes, meaning changes in letterhead, changes in uniform. How soon do you expect this to go live?
Well, we're actually having a meeting next week to determine that go live date, but you are correct. I mean, every piece of paper, every pen, everything has to have a logo change or a name change. And that's another point. We are currently working on a new logo as well as a new color scheme. So that has to happen before we can go live with the name.
Okay. Now, you just mentioned just the expansion of Franklin Foundation, because now it's a health system. Tell me more about where we are with the Wellness Center. Of course, we had Senator Brett Allen here not too long ago, and I guess every time we have someone from the hospital, we want to know where are we in the progress of this facility.
From construction standpoint, we're about 48% complete. The construction is going to be completed in January of 23, and we're planning on having a soft opening sometime in March. It's very exciting. We're so excited for this whole thing to be finished and get rolling, because everybody wants to be a part of the fitness center.
Yes. And, with all the changes, I mean, this is kind of like hitting us all at one time. Like, how long have you guys been working on changing the name and just everything around it?
It kind of evolved around the time we found out for sure that we were going to build the wellness center. And then it was mentioned by a couple of people, well, do you think we need to consider, rebranding, expanding our brand and everything? And so it kind of started at the same time.
Okay.
And grew.
So you guys kind of really moved really quickly with this.
Yeah, it's been a whirlwind.
Yes.
It really has.
And there's a board, correct, that decides on this, about how many people, because that's another thing, getting everyone on the same page, about how many people had their hand in
Well,
this
we have
decision.
a board of commissioners, hospital board of commissioners, which is 7. But we had a focus group. We enlisted a company that helped us pull together a focus group of hospital employees and a focus group of the community. And there were 39 participants in the focus group. And that's how we utilize our resources with those people to say, okay, who do we need to be, what's important to you in a name, you know, those kinds of things. It was very interesting.
Awesome. So that means really the community actually had a hand in this
Absolutely
as well.
did.
So that's going to be interesting once we start to hear feedback coming from the community to see exactly, they may be more aware of it than I am. You know, that's usually how that happens. But come on back right here on the Voice of the Coast with yours truly. We have much more to cover on now, formerly, Franklin Foundation Hospital, now or soon to be Bayou Bend Health System. Welcome back to the Voice of the Coast. I am your host, Danique. Along with me, we have Stephanie Guidry, who is the CEO of Franklin Foundation Hospital, soon to be Bayou Bend Health System. Try saying that 5 times, especially because it's so new. It will be so new for folks to get used to saying. But you know what? My dad told me something. He said people are a little less apt to change. But if you say we improved something, they will jump on that really, really quickly. So we're going to start calling it more of an improvement.
Yes,
maybe.
that's
so
great.
Let's talk a little bit about you, though. I mean, you've been here now for 5.5 years. With the new improvements to the hospital, where does that put you?
Well, I'm here to stay. You know, I'm going to retire from here. I'm buying a home here on the Bayou, and I've been here for, like you said, for 5.5 years, and I've loved every minute of it. I love the community and the people and taking care of our community and being involved. So I'm not going anywhere anytime soon.
Okay. And all around, there's just so many things going on around the hospital. So not just on the hospital, but also around the hospital. Again, let's go back to our conversation with Senator Brett Allen, and he's had his hand in the wellness center. So we also have now some new access or ways to get to the hospital. The roadway will also improve.
Yes.
So tell me about that.
So he has put funding in place to do a roundabout right there on the corner of Chatworth and Northwest Boulevard. I don't believe it'll go in until late 23, maybe early 24.
Oh.
But, and he also appropriated funds to put lampposts from
That's
90
right, yes.
down Northwest Boulevard. So it's going to be really nice and really pretty.
And I think that's going to be such an upgrade for St. Mary Parish. And I'm going to say this again because I said it when he was here. I got so much flack for even suggesting a roundabout for Morgan City. So you guys are going to be kind of our guinea pig and see how well it works. So, and for those folks who are like, I don't want a roundabout, well, Franklin's getting one.
Yeah.
And it's going to allow better access to your hospital.
Well, that 4-way stop is a nightmare for most, so it'll be a positive improvement.
And it's kind of like it gets rid of that whole just, you know, the small town with the one red light type of thing, right? You know, you have that flashing red light. Let's also talk about changes within on the administration side. Are there any changes there?
There sure are. We have a new chief nursing officer. Her name is Mary Rios. She came in as interim in January and took a full-time position in March. So we're really excited to have her. And then we have a new CFO, Tyler DePlantis, who actually lives in Berwick and is local.
Okay.
And he started 2 months ago, and we're really happy and excited to have him as a part of our team.
And you know, you mentioning that you bought a home in St. Mary Parish. We also have this young man that you just mentioned who's also local. I think that's something that we also should talk about, just having people move into this community.
Yes.
Yeah, so I guess maybe with the name improvement or upgrade, it kind of brings people into our community.
Well, the wellness center, I think, is going to be a huge draw, because when you ask people what they need in a community, they need a church, they need a hospital, they need schools, and they want somewhere to go to socialize, to work out, to have a good time. And you know, in that fitness center, we have 2 pools. We have a lap pool and a exercise therapy pool. So it gives us one more option for recruiting new residents.
Awesome. That sounds very good. I'm always about the cha-ching. And lastly, let's kind of talk more about what's going on at the hospital as far as the health of this community. We are still obviously in a pandemic. Where are we with our COVID numbers?
Well, the COVID numbers are going up, unfortunately. We're seeing more and more patients in our ER. We're admitting patients with COVID. So, you know, it's here to stay, but right now we're in somewhat of a surge.
Yeah, so we are masking back up.
We are masking back up.
Okay. All right. Well, thank you very much for this.
Thank
And you
you.
heard it here, Bayou Bend Health System to come over at Franklin Foundation Hospital in Franklin. And of course, with all that, so many other new additions. So make sure to stay tuned. It'll be changing sometime early 2023. So we'll see you guys next time. Make sure to subscribe to us on Facebook. We are KWBJ TV 22.